Good evening, everybody, and welcome to the Joint Base San Antonio Virtual Town Hall to discuss all things novel coronavirus, COVID-19, and the efforts that we're taking to protect all of our service members here at JBSA, their families, as well as steps that we're taking in the community as well. I'm Dan Hawkins from the Air Education and Training Command Public Affairs Office, and I'm going to moderate tonight's conversation. And we have a great panel for you tonight for this town hall. Sitting immediately here to my left, Major General John DeGoes. He's the commander of the 59th Medical Wing. Brigadier General Laura Linderman, she's the commander of the 502nd Air Base Wing and the installation commander for Joint Base San Antonio. Beside her is Chief Master Sergeant Chris Lantain. He's the command chief of the 502nd Air Base Wing and Joint Base San Antonio. Along to the left of Chief Lantain is Colonel Mike Newsom. He's the commander of the 737th Training Group, as well as basic military training here at JBSA Lackland. On the other side of Colonel Newsom is Captain Skip Leitner from the U.S. Public Health Service. He's working with the Associate Secretary for Preparedness and Response for DoD support to DHS operations here at JBSA Lackland. And then finally, we have Dr. Eric Kozowski from the CDC as well. And so as we start off this conversation this evening, we wanted to first start with General Linderman as the installation commander here at Joint Base San Antonio. And ma'am, there's been a lot of changes with COVID-19 response, and there's a lot of things going on with the current operating status here at JBSA. So I wanted to give you an opportunity to take the floor first and kind of talk about the changes to our force protection health conditions and kind of this decision space on how those decisions were made and what it means to JBSA.
All right. Well, thanks, Dan, and welcome everyone. Thank you for joining us this evening. We do appreciate your time, and we do want to answer all of your questions. And so with that, I can walk you through the decision-making process for health protection condition that we're currently in, which is alpha. So on a day-to-day basis, we're normally at 0, which means there's no threat, no credible threat in the area related to our health and fitness. But over the last several weeks, we've been monitoring the situation here and around the world and across the nation. And we have a health protection working group that meets every day. And that working group, we stood up as a result of the coronavirus and the spread as it started to gain momentum around the country and the world. And last Friday, we had a tabletop exercise where we talked about our current health protection condition at 0, and did we need to elevate it based on what we were seeing in the news, and also the fact that we're a training installation and we have a very vulnerable population in terms of the numbers of people that we have on all of our installations, and they're very close quartered. And so with that, on the advice of our medical team, General DeGoes and Colonel York, our public health officer, as well as many other experts in the room, including BAMC and the medical teams, we have decided to elevate to alpha. And really that's more of what we were doing already. And it's pretty much common sense. It's washing your hands. It's considering sanitation, and rather than shaking hands, maybe you're doing a fist bump or an elbow bump, those kinds of things that would potentially reduce the spread of some of the germs that might potentially be a part of the problem. And we continue to monitor it in terms of what that means, and if we need to elevate it in the future, we will. But at this point, the threat is low here in San Antonio. There are no local cases spread through communication amongst the San Antonio population. And so with that, we feel alpha is the right condition at this time.
And General DeGoes, when you talk about the San Antonio military health system, as General Linderman pointed out, we have no COVID-19 confirmed cases here in San Antonio. But what are some of those CDC recommendations, and how can not only base residents but our airmen in training, how can everybody take care of themselves?
Right. Well, the CDC has put out, guidance of, prudent guidance of how you could avoid transmission, and so avoid mass gatherings with the close contact. really avoid unnecessary touching. So as General Lenderman mentioned, reducing handshaking. So we're kind of doing elbow greetings now. Stay at home if you're sick. I think that's just common sense, but right now it's even more important. Cover a cough or a sneeze, not in your hands because it's more easy to transmit germs, in the crook of your elbow, or into a tissue or a handkerchief. Clean and disinfect frequently. So, use Purell, wash your hands frequently. If you're washing your hands, wash for 20 seconds with soap and water. Sing happy birthday to yourself twice, that's typically 20 seconds. Try not to touch your face if you've got unwashed hands. And if you don't have access to soap and water, Purell works well, and particularly before you're going to eat, again, washing your hands. So those are just some basic things that you can do to reduce the risk of getting it yourself. And then again, if you become sick, there are options for you to how to prevent transmitting illness to others, and I think we'll talk about that in a little bit.
Yeah, and I really wanted to also give you an opportunity, as General Lenderman talked about the base moving to HB-Con alpha as a condition, but maybe if you could just talk to what an HP condition is and what that really means.
Sure. So again, they have been developed just recently, and many of the audience is probably familiar with force protection conditions, and that, in normal ops, when there aren't any threats, we're at force protection condition 0, and that's what we are in normal baseline, kind of doing routine standard precautions. So when you go into a healthcare facility like Brooke Army Medical Center or the 59th Medical Wing or any of our 20 clinics around the city, we take normal personal protective things. We wash our hands before we see a patient, before we go to the next patient. We do normal infection protection kind of things to reduce the risk in hospitals and in clinics. Just like force protection conditions, there's a graded response to when the threat goes up, the health threat goes up, to Alpha, Bravo, Charlie, and Delta. And so it's kind of, limited health alert, then you would go to Alpha, which is what we recommended the Public Health Emergency Work Group and the medical leaders of BAMC and the 59th to General Lenderman because there's increased threat in the United States, transmission in many of our large cities, and that San Antonio is an international city with lots of travelers coming in, that the probability of infection and community transmission is becoming higher as the disease is more prevalent throughout the country. So this is a prudent action to take care of our mission, which is really important. It involves training the next generation of airmen and to take care of the people on our base. And many of those people that work on the base live in the San Antonio community. So in addition to protecting our mission and the people executing that mission, this action, this recommendation was taken to also protect the community, the local community that many of our employees, healthcare workers, non-healthcare workers live in, to reduce the risk of infection inadvertently coming from the base into the community. And as you all know, Military City USA, we bring people from all over the world and we send them to many other places in the world, so further to reduce that risk as well.
And so as we kind of shift gears here and talk about basic military training, I know that's been a big topic of conversation. Decision was announced yesterday, General Lenderman, to basically not have mass gathering events here at JBSA, which obviously includes probably the biggest one, and that's basic military training. And so it's not just basic military training that's infected. We have a lot of missions here. We have 266 mission partners, flying training, technical training, basic military training, our joint and international training that's involved, and the base support mission of the 502nd Air Base Wing. So can you kind of talk to the basic military training decision specifically.
Sure.
As we know, a lot of our audience obviously is concerned with the timing and all the factors that went into that.
Yeah, absolutely. So, so the timing is not good, and the timing's not great. And unfortunately, this is a very fast-moving train, and things are changing every day. And I think just today, General DeGoes, you said the World Health Organization declared it a pandemic. So this is happening like real time. And as I said earlier, we did meet on Friday, and we had a tabletop exercise, and we made the decision to move into Alpha. Throughout the weekend, things started to gain momentum, and then on Monday, there were some indications that it was time to consider our mass gathering decisions and whether that was prudent for us to continue to have large groups of people coming together in an environment where there's lots of trainees. And this is the Air Force's only pipeline for basic military training. The Navy had made a similar decision earlier in the week where they also canceled their attendance at their graduations in Great Lakes, Illinois. One of the larger Army installations responsible for infantry training, they also made a similar decision at Fort Jackson, and it was just time for us to be cautious, because like we've said, our priority is the health of the force, and that's across Joint Base San Antonio, all the services. It just so happens this week we do have graduation, as we do every week, and we tried to make the decision as quickly as we could so people could stop their travel plans or adjust their travel plans. But we know this is really hard on the families. It was an extremely hard decision to make at our level, and we're extremely empathetic and understanding that this is hard. Families have been waiting to see their loved ones. They've been wanting to see their sons and daughters and granddaughters and grandsons and husbands and wives graduate this week, and we didn't do it. We didn't make the decision lightly. We definitely didn't. We took our time in making the decision, but we do realize that this is a hardship for a lot of people, and we're here to make it as smooth as possible. We're going to expedite getting our students onto their next location so they can see their loved ones. We're going to live stream the graduation ceremony on Friday and make some other accommodations so that our trainees can see their loved ones in a timely manner.
Yeah.
With that, if I could, I'll turn it over to Colonel Newsom from Basic Military Training, and he can talk a little bit more about some of the plans that they have for this week's graduation.
So let me begin by, empathizing with the fact that parents and their loved ones were planning on coming here to graduation and so forth. The health and welfare of our trainees, our MTIs, your sons and daughters, are vitally important, right? So any measures that we can take to ensure their safety and welfare is our top priority. As General Linderman was indicating, the graduation will be live streamed on Friday here at the PRC. So the trainees will actually be here at the PRC. Just a word of note, at any given day, we have close to 6,500 trainees and any particular week of training. So we have a very large population, graduating close to over 800 this Friday. But taking that into consideration, again, the top priority is ensuring the safety and the health of those trainees and our staff is what we're considering in regards to the measures that we're taking going forward. So you'll still be able to live stream. It will be live streamed so you can actually see your loved ones during the graduation aspects of BMT.
And I think we've had a few questions, Colonel Newsom, too, and for General Linderman and maybe General DeGoes as well. But this isn't something that has a timeline. Like, we can't say, oh, well, in 2 weeks we'll be good to go, right? This is something that it's going to take some time to work out.
It is, and I wish I could put a timeline on it. I think we'd all feel a lot more comfortable knowing, because I know lots of parents have already bought their tickets for next week and the week after that and the week after that. And so we are going to look at it every day and make an assessment every day. And when it's the right time, based on the health risks and with inputs from our training commanders, we'll go back to operations normal. But right now, we just can't make that call at this point of when it's going to end. we'll be watching just as everyone else is, and getting the best advice that we can, and making recommendations to our senior leaders. But right now, this is the right thing to do for this environment here at Joint Base San Antonio, to protect all the people on the installation that live and work here, and those that are going to go on to graduate this weekend.
And we have had some questions, and Colonel Newsom, this is more in your lane, about the liberty and how that's going to work. Typically, after graduation, trainees who've graduated have the opportunity to spend time with their families, go off base, or their families come on base and tour their squadrons. Could you kind of talk to how that's being modified in the light of the current circumstances?
So based on the current guidelines of restricting off-base pass and base liberty, after graduation, the trainees will go back to their dormitory squadrons as a measure to try to lessen the blow in regards to them being able to interact with their loved ones. We will allow them to have their phones so they can call and things of this nature to, to talk with their significant other or their loved ones and so forth going forward, which is one of the measures that we normally don't do. But considering the circumstances and the situation, that we are making those amends so that way they can at least have contact with their loved ones.
And I think we've also had quite a few questions in terms of the screening, right? So we're restricting access to families, and some of the questions have been like, well, what about the threat from somebody just coming into BMT? And there was a story out today from the 59th Medical Wing about some of the screening now that's being done for recruits coming into BMT.
Right. So Colonel Newsom can correct me, but I think Tuesdays a new group comes in on planes and buses into this very building and gets screened in. And so we are giving screening questions to, are you feeling ill? Do they have symptoms of coronavirus, the novel coronavirus, which are similar to flu, cough, cold? Do they have a fever? And to make sure that we wouldn't put them into the training pipeline, that we would isolate them, treat them, and if they met criteria, would actually test them for influenza or COVID-19 if it looked like they were, had exposure, credible exposure. So yes, we're trying to prevent them from joining the training population. And one of the pieces of information that went into the recommendation for preventing the mass gatherings was that the training environment is close quartered. And so if one case gets through, it's much easier to transmit to the entire pipeline. And we call it a pipeline because everything is at a particular time frame. And if many get infected at once, it would really impair the mission. And so we're in an abundance of caution. We're being extra careful to screen for symptoms of potential exposure.
And you're absolutely correct, sir. So last night we received the shipment of our new recruits coming into DMT. A series of questions are being asked to them. If they meet one of those particular criteria, they are then separated into another room, and then they are asked additional questions in regards to, do they feel ill, do they have a temperature, if they have any of those particular symptoms, partnering with the med group, the 559th, then they will further be checked out by a physician, and if they meet these particular criteria, then they are separated from out of BMT. I would say that, and luckily, knock on wood, that there is nothing that occurred last night that will give any indications that someone had those particular symptoms that would lead to A, B, C, and D, the second and third order effects in terms of further medical screening.
Right. And just to how in depth they're planning for the safety of the community and the mission, they know if a prospective recruit was coming from an area of high transmission or a level 3 country. Right now there are 4 level 3 countries: China, Iran, Italy, and South Korea. And so to make sure and that we're following CDC guidelines to restrict travel from those areas.
Right. And those are the series of questions that we ask them as well as they come into during the processing.
And as part of that is some of the questions that we've we've got, because I want to definitely get to our viewers' questions. One of the questions that we had was why we didn't just limit the number of BMT graduation guests instead of just restricting it completely across the board and not having the ceremony. But I think, sir, it probably comes down to a threat's a threat. A transmission threat is there.
Right. And one of the things about this virus is that a large percentage, somewhat maybe a little more than 50%, may have few or very minimal symptoms, some even no symptoms at all. And so even with appropriate screening, people may actually inadvertently have the disease or not knowingly have the disease and potentially, expose others. And so, again, out of an abundance of caution, we thought because there's active transmission in many areas of the United States where families come from, the prudent thing was to reduce mass gatherings. Some of the audience might say, hey, Dr. DeGoes, that's a level C measure. You're only in health protection condition alpha. Well, because of the mission here and the close proximity of the trainees, we thought it was important to add that aspect of a preventive measure, again, for the mission and the community we all live in.
Another question we got from the audience was, can local military actually attend any of the BMT graduation events? And like we talked about, it's going to be closed, correct, Colonel Mason?
That is correct. So it will be held here in the PRC and restricted to the trainees at that particular point in time. However, again, as a measure, it will be live streamed.
So, and you talked about the phone, so they have access to be able to have that connection at least with their families, which is not our typical process. So accommodation being made there. But General Linderman, I kind of wanted to transition just a little bit, but part of the decision making was about mass gatherings, not just BMT. So how is this going to impact JBSA when it comes to things like retirement ceremonies or 5K runs, events that the base typically organizes?
Right.
What does that look like?
Well, we're actually working through those questions right now. I mean, in the interest of time, we focused in on the military training graduation ceremonies, but we're going to have to look at each case, and we have a repository of all the events coming up, including the ones that you mentioned, and we have some large events coming in the near future. And I know the city of San Antonio is doing the same thing when it comes to the Fiesta gathering that's occurring next month. So each case, we're going to have to take the health and risk to the force and risk to mission, take that into account when we consider if we're going to allow a certain large gathering to occur or not. So more to follow, but it'll be on a most likely case-by-case basis.
And we have some more questions, and we're definitely going to get to them. But before we roll into just the straight Q&As, I wanted to give Captain Skip Leitner the opportunity to talk about what's happening in terms of the CDC response and our support to DHHS operations, sir.
Great, thank you very much. I want to say thank you for having me and inviting me on this panel to discuss our mission. My name is Captain Skip Leitner. I'm U.S. Public Health Service Commission Corps officer, and I'm serving here at JBSA as part of the ASPR mission. ASPR, that abbreviation is Assistant Secretary for Preparedness and Response. I want to briefly outline how the base has served as a repatriation point during the COVID-19 response. First, though, I want to say thanks and what an outstanding experience and partner I've had and it's been here at interfacing with JBSA. At every point, ASPR mission, it's been bolstered by the professionalism and the mission-mindedness approach of the personnel here at JBSA. It's one thing to have a mission. One thing to have a mission is quite another to have a partner in the process, and I have truly appreciated the partners here at JBSA. To begin with, let me rewind a little bit about what our mission has been here. Let me give you some numbers, just to give you a big picture of our mission here. There was the first cohort was the Wuhan passengers fleeing that region, all with citizenship ties to the U.S. They arrived here February 7th, and they completed a 4-day federally mandated quarantine, and that was 91 people. There was a second cohort, Diamond Princess cruise ship, which I'm sure everyone was familiar with. They came in February 17th. There were 135 people from that cruise ship. There's still 8 here remaining. They're actually in isolation at a facility here in the San Antonio area. Yesterday, we received, Tuesday, March 10th, we received 98 passengers who began their quarantine. That came from the Grand Princess. All 98 are healthy, and we're hoping that they stay that way. I think the summary of all that is that quarantine is for healthy people. We want them to stay healthy, we want them to do the social distancing, all the things that have been discussed here at the panel. Sick people, when they're tested positive, they're moved to isolation so that they can go through the process of being sick and then get released as they can. And thank you again for letting me be on this panel and having an opportunity to talk. And I look forward to any questions.
Yeah, and we did actually, sir, get a question, and it's for Dr. Kozowski, but the question is why are quarantine passengers only being screened instead of tested before they're brought here to Joint Base San Antonio?
Right. So what we know about this coronavirus and its two cousins, the severe acute respiratory syndrome coronavirus and the Middle East respiratory syndrome coronavirus, is that their incubation period tends to range between 2 and 14 days. So testing somebody early after the exposure wouldn't necessarily detect the virus if a person was incubating it but not yet ill and not yet shedding the virus. So this is why we've got to go through this full 14-day quarantine period to allow the virus, if you will, to sort of declare itself. But I understand the sentiment of the question, and it would be a whole lot easier if that were the case, if we could just test people, and if they were negative, then they're free to go.
Another question related to the quarantined individuals is why and are they allowed to be outside of their quarters? I think that's a common question that we've been getting as well, Captain Leitner.
Yeah, thank you. I think the main reason is that, first, 6 feet out, right? That's our recommended social distancing, and they are quite far away from anybody because we have our zones fixed so that they know their limits, and so they can roam outside the virus. And Dr. Kozowski could probably speak to this better, is that sunlight and being outside, it does not survive very long, if any at all, outside. So being outside is okay. In fact, I've seen some of the people there walking around in their masks, so they're being extra cautious as well.
And I think another question, Colonel Newsom, General Linderman, is I think sometimes people get what's going on with the quarantine operations and what we're doing from a technical and basic military training perspective, like they're in close proximity to one another, but in reality our trainees are never even close to being in the quarantine areas.
I'm sorry, ma'am.
No,
You're absolutely correct. So within the BMT training environment, what the captain was talking about is separate completely from the BMT training environment, nor are they allowed to even go around in those restricted areas as well.
And we have a fence, just
That
to
is
elaborate on the colonel. We have a fence that surrounds the site, just so we know where the quarantine area is, and that they also know where the quarantine area is. So it's very, very clear, very obvious.
General Linderman, this question's probably more in your lane, but we've gotten actually a lot of questions about teleworking from employees here at Joint Base San Antonio, wondering what procedures potentially could trigger teleworking. And I know individual commanders are making risk mitigation procedures and plans. What can you add to that?
So thanks, Dan. I know that our civilian personnel offices are pulling the information together, similar to what we do when we might be facing a furlough, and getting that information out to our different commands across Joint Base San Antonio. Because this is a good time to consider teleworking. It depends on the mission, and it's truly up to the commander. So I don't issue a teleworking guidance or guidelines or directive from my level, but I do provide the information and allow the commanders, as they're responsible for their workforce, to determine who should telework and who shouldn't. And we're not at the point now, writ large, from HPCon Alpha, that if you're not already in a telework status, we're not saying that this is a time that we need to go to it, but it's a time to consider it in the future. So it might be good to get the folks that would be eligible for teleworking based on their mission requirements, and maybe get the paperwork in order so that if there comes a time when we do need to have people stay home at the commander's discretion, that they're able to do that rather quickly.
Colonel Newsom, a question for you, sir. How long will BMT graduates be having access to their phones to call their loved ones this week?
So what we're doing as of now, after they graduate on Friday, we're going to actually ship them out that Saturday, right? Where it used to be like on Monday, but we're shipping them out to their tech schools early, which begins on Saturday. So they'll have their phones all the way up until that time until they also get into tech schools.
Okay, sir, thank you. Ma'am, another question for you, General Linderman. If a child at the CDC tests positive, how are there plans in place? How will that be handled? Obviously, care of our children, our number one priority as parents.
Absolutely, and thanks, Dan. We were actually talking about this through the health working group. We've been talking about what happens if we have a positive test in the Child Care Development Center, because as every parent and every family member knows, those are mission essential, and that will have a direct mission impact on our team if there is a positive case. So walking through that's the job of our health protection working group, and they'll follow the protocols in terms of notifications. They'll do some tracing, which is determining who that child came in contact with. I can't lay out all of the steps here in this forum, but just rest assured those are the things that we will be looking at. And if it came to us having to shut down a CDC, we would do that in the abundance of caution to take care of the greater community. But again, this would have a large impact on the mission. We do have quite a few CDCs at JBSA, and many children on the waiting list as well. So we recognize that this is an important COA, or course of action, a branch that we need to walk through so that we're prepared in case that does happen on our installation.
And ma'am, another question for you from a base support perspective. The question is in generalize here. Is there a way for security at the gate to be able to view ID cards without actually having that person-to-person interaction?
Right.
And I know, security is obviously one of our top priorities.
Absolutely. And that's another aspect of base support that we've already walked through. So our Security Forces Commander, he and his team got together and walked through these are the actions that we'll take under health protection Alpha, Bravo, Charlie, and Delta. And so if we progressed and did elevate our health protection levels, certain steps would be taken and it would get more conservative. Right now, there's no driving force for us not to physically check ID cards. Some of our defenders at the gates, though, are wearing gloves. That's their choice out of something that they're comfortable with, but it's not because there's an increased threat through the ID card handling. But if there comes a time when we need to step to that next level, then we would consider you just showing your ID card and doing it through the glass window versus handling it to the Security Forces member. But we're not at that point yet.
Yeah, and I think, and I know we've kind of hit the BMT pretty hard, but I think it's also an important delineation to make that, the cancellation of the mass gathering, that is not in any way directly related to the quarantine ops. Those are two separate decisions.
That is correct, sir.
And the timing is interesting. As I mentioned, we had our team together on Friday, and that's when we decided to go from 0 to Alpha. And at that point, we weren't expecting to get any more cruise ship passengers. So that was an independent decision. And then over the weekend is when we got word that we would be receiving more passengers. So just for what that's worth, they were two independent decisions.
General DeGoe's, a question came in about SAMC and the medical facilities and their ability to support the city's medical resources from just an overall support perspective. how does that look like? What does that look like?
Right, so we are on a daily basis, the San Antonio Military Health System, over 10,000 military medics, working to prevent the spread and aid in early diagnosis, but also working with our San Antonio Metro Health District partners through the public health relationship, and to see kind of, how we can help each other, because typically infectious diseases don't respect the wire, the fence line. And so we continue to work daily together. If there was a significant need in the community or the state, there is a mechanism for the governor to, ask the president for help, or via Health and Human Services, if they felt that they needed to be involved, they can ask for help to the Secretary of Defense. So the mission that the Department of Defense is giving defense support to civil authority right now is this mission that we're doing right now to support the evacuees or quarantined. If things reached a point where the parts of the nation were overwhelmed, we could get to a point where an additional defense support to civil authority mission might be actual patient care. And so we've done things like that with hurricanes and other disasters, and so there is a mechanism for that to occur. And typically with an infection of this magnitude, something that the World Health Organization calls a pandemic, it requires a whole of government response. So Health and Human Services, Department of Defense, city, state, local governments, all working together to protect the American people. And so if we get to that, we obviously have a primary Department of Defense mission that is always primary, but would do everything we could, if we had the permission and the authority given from the Secretary of Defense to help.
And another thing I really wanted to hit is, we talked about before we actually came on live, but one of the things, if you are having symptoms and you feel like potentially you could have been exposed to the virus or are carrying the virus, that before you seek care from BAMC or the Family Emergency Center, that you should really consider calling in before you show up, because you're putting a lot of people at risk.
Right, and so calling ahead, so we've armed, if you will, our centralized appointment management line for military beneficiaries, TRICARE beneficiaries, with a protocol, to kind of guide people in how to come in safely. And all of our primary intake areas within the San Antonio Military Health System, if you've got a cough, we've got a mask right there, we've got hand sanitizer right there, and we have protocols at all of our entry clinics, emergency rooms, primary care clinics, and the ability and a protocol to isolate patients right away. But if you're not sure, the best thing to do if you're a military patient is to call our nurse advice line. We have a free 24/7 monitored by registered nurses that are following evidence-based protocols. Many of them come from the Centers for Disease Control. You can call them and they can help you decide, is this a home care thing, or do you need to come in and be evaluated, and they can even help book you an appointment. And just the nurse advice line, maybe we can put it on the internet, but for military beneficiaries, it's 800-874-2273.
And General Linderman, this one I kind of throw to you as the installation commander, but obviously this week probably a lot of emotional ups and downs for both airmen who are here and wanted to see their families, and then families who were coming. But and we know it's disappointing that they can't come, but a lot of them have expressed, is there a recourse for us because we bought plane tickets? And although there is no recourse from our end as a government from that perspective, we are obviously thinking about the airmen, their families, and all of the considerations that go into their health and well-being as we make every decision with all the people at this table and many more every single day.
Absolutely. And You said it very well, Dan. This decision we did not make lightly. This was a really hard decision, probably one of the harder decisions that we've made in my command here, because we know what it means to come. We get to be a part, and especially Colonel Newsom and his team, be a part of these celebrations and life-changing events for both the member and the family. And our heart goes out to everyone here that's impacted by this. But we also have a responsibility to our nation and to all of the community outside of our fence line to protect this capability that we have here at San Antonio, which is our training pipeline. And we take that responsibility very seriously. And I'm extremely sorry that this is impacting so many families who have traveled very far and spent a lot of money to get here. But we do think this is the most prudent and most critical action that we can take at this point to prevent any spread of this disease onto the installation.
And I think it's also important to note, I know we have a lot of questions about technical training, and will those graduations be canceled, or will families be allowed to come to those installations to see airmen? And I think right now those are decision spaces that are still being worked within Air Education and Training Command.
Yeah, this is definitely a fluid environment in terms of where we are, and this is the decision that we've made for now. This is the near-term decision to cancel mass gatherings, if you will, and we'll continue to look and see when we can move forward and allow our graduation ceremonies to reconvene. But at this moment, this is the most prudent action that we were able to take based on the evidence that we have.
I know we still have a couple of more questions that are flowing in, but I'll turn it over to you, sir. We also had a question about, like, well, how do I know, like, what kind of symptoms would I potentially be displaying that I should call the nurse advice line about? I mean, you could be sick, but you know, what in this day right now, people are a little concerned if they sneeze.
Yeah. You know, I think if you're uncertain that, let's say you think you may have been exposed to somebody who you found out, you know, a week later has COVID-19, call and ask questions. But the symptoms that we would be looking for, and I have a world expert here in Dr. Kasowski, but fever, sore throat, headache, you know, chills, kind of things that are very similar to influenza. And I just say that right now there's a lot of influenza going on in America, and in fact there's a lot of San Antonio civilian hospitals are filled with influenza patients right now. So those would be the things that we would be looking at, and then particularly looking if you had any kind of exposure to communities that are having active transmission of COVID-19.
And we talked a little bit about it earlier, about the social interaction and the social distancing that we're calling it now. But one of the questions that we actually got earlier was about how isolating that potentially could be for somebody who is more of a social person. So what kind of mental health tips or resources might you recommend to help people who might have that issue?
Right. And so, you know, in one area, we're trying to actually increase connectedness and to have leaders, frontline supervisors understand more about their people and recognize early if they're having problems as reducing stress and reducing suicide prevention. But here we're now saying, you know, social isolation, social distancing is actually good for preventing infection. So we had the same nurse advice line if anyone was having any stress, about, you know, fears about it. Military members, the city actually, San Antonio Metro Health District has a COVID-19 hotline for residents to ask questions about the virus. For military members, we have a thing called Military One Source that has an 800 number that you know, you can call for help with that. There are free, no questions asked mental health visits for family members, and we have plenty of mental health access in the San Antonio military health system, and including we're beginning to do virtual mental health, where, you know, if you're not comfortable coming in and you'd rather do it through a you know, video chat, with a psychiatrist or a psychologist, we have that available as well. And so, while we're balancing infection prevention and the social isolation, we don't want you to have problems become non-addressed. And so there's plenty of ways through telephone and the internet that we can address those.
So last question before we start to wrap it up, but are there any plans, General DeGose, to curtail any of the medical services right now at BAM, Cedar Wolf, that you're aware of?
None. So there's none at all. And I mean, again, as everyone said, our current plans, we are going to evolve our plans as this threat evolves. And so we have no plans to change any health care. And I would say that many of our nation's hospital systems are preparing now for just in case. And so while we don't have any infections in San Antonio, I know our community partners in the San Antonio Metropolitan Health District and the San Antonio Military Health System are preparing for what if we got a bunch more cases. And so, having temporary facilities and ways of expanding capacity. So no plan to curtail to any of our beneficiaries, and preparing for what if there is, a run on the store and so we're preparing for that, hoping for the best, but preparing for just in case.
And ma'am, as we get ready to wrap it up, I kind of wanted to give you the opportunity to provide some closing remarks.
Sure. Well, thanks, Dan. So I just wanted to say thank you to General DeGose. Thank you to Chief Lantain, who's been an incredible support throughout this in terms of helping communicate throughout the training environment. Thanks to Colonel Newsom, and thanks to our interagency partners. We do appreciate you. And we were able to host our Chief of Staff of the Air Force was here today to do exactly what we were talking about tonight, to get his eyes on the site and see what's happening here at Lackland and answer any questions and provide resourcing help if we needed it. So I do want to thank our chief and his staff for being here today. But to all of you out there that are listening and those that are impacted by this issue, I do want to say thank you. Thanks for your support, and thanks for your questions. And please, we are here as a team. We're here as a command team, and we want to be able to answer any questions you do have. And know that as soon as we can move forward and get back to normal operations, we will. But for now, based on the advice of our medical experts and the team here and the training team that's part of Joint Base San Antonio across all the services, we're doing what's most prudent and what's most protective of our workforce here. And it's our trainees and also the trainers and all the people that live and work across Joint Base San Antonio.
And so that'll wrap up our town hall. We want to thank you for tuning in. If you have other questions, please go ahead and drop them in the comments. We have our social media team who will pick those comments up, and we'll get the answers and get those questions posted. General Linderman also has her Feedback Fridays program. You can follow Joint Base San Antonio on Facebook, Twitter, and Instagram as well. So please, this isn't the end of the question train. We know that, and we definitely want to answer your questions as you have them. So for our entire JBSA team here, I'm Dan Hawkins. Good night.